Hi, Laura.
Hi, how's it going?
Good. Well, I'm so glad to have you today with us so we can have a dialogue about the collaborative therapeutic approaches that I've been practicing with you and some other therapists. So we can share, based on our behind the scene work we're doing collaboratively, how that will benefit our clients together.
Yes, thank you for having me. This is really important. So, yeah, I'm glad we're having this conversation.
Yeah. So the collaborative practices, as you know, it's not new at all, right?
Mhm.
So I'm thinking about the medical rounds. They do the rounds in the morning with nurses, doctors, RCAs. They'll sit together. And when I was activity therapist, we'll sit together to share what we learned about each patient that's in the unit. So that's the medical model. And in school systems, they have the MDT, right? Multiple disciplinary team meeting
Mhm.
where speech therapists and sometimes OT, occupational therapists, and they will sit down with the mental health consultants and the teachers and the parents to talk about a child's behavior and how to support a child to achieve their academic goals, right? And then divorce, and nowadays, especially in the Bay Area, we have the collaborative practices between a social worker, mediator, and financial planners and attorneys sit down with the clients to collaboratively support them to resolve their marriage, right? So I'm like, why don't we do this among therapists? I think we do, right? In group practices is a default. You kind of refer each other, your individual clients and family or couples clients. So the clients stay in the group
Mhm.
practice, right?
Mhm.
Is it more based on financial benefits or interest in some way? And also the therapists already belong to the same organization. They know each other, right? So, but what I'm talking about today here is for individual therapists who are solo practitioners. We decided to collaborate together based on our clients and the cases without any financial benefits. We're bonding among all of us. We're all independently charging and we don't have any benefits for each other. Purely based on specialty, the relationship with the clients, and sometimes demographic preferences, right? So we collaborate and we work together on the same couple or family. Would you like to share a little bit about the process? Like, how do we do that? How do we engage with
Yeah.
each other and the clients?
Yeah. Well, first of all, just emphasizing this is really important, both for our work as therapists and also for the benefits of the client. But in terms of the process, often one of us is starting to work with a client who, like for me, a significant part of my work is individual, working with clients as individuals. And so oftentimes a client who's working with me is also at the same time in couples therapy with you. So one of us might bring up with the client, hey, it would be really beneficial to your progress, both in your relationship and as an individual, for us as individual and couples therapists to connect, align the way that we're working together. So we're supporting you in this more comprehensive way. Um, what happens is it's often pretty simple. The client, if they agree to that, will sign a release form allowing us formally to connect and share information. And then, you and I will schedule a time to talk and we'll share the most relevant information. And then, most importantly, talk about how best we can support these clients in an aligned way going forward. And then we might check in kind of periodically to make sure we're making progress in the way that we set out from the beginning.
That's right. Thank you. It was very clear, and you made it sounds like so easy. It is actually quite easy.
Because I think it's easy for the
Yeah.
client.
Yeah,
Yeah.
it's very easy for the clients. The client just need to sign a release form. Sometimes just one form, say if I send the client the form, they will put both of their name on and sign it and to say this is to give and receive information from, say, Laura. And that will do it. It's all done electronically. It takes only like a minute or two.
Mhm.
And then we will forward each other the form, say, hey, we would like to talk about this mutual clients that we share. Here's the consent form form, right? We review and then we schedule a time that works for both of us. It's a little bit tricky for therapists to get together. We all have different schedules, but we are so good at scheduling. Laura and I have never had a hard time finding
Yeah.
time to speak to each other about our joint clients, right? And we do talk about goals for individual therapy, right? For me, the couple therapy, where are we in the developmental stages of a work? Can we align, say, oh, can we align on working on this piece together for a period of time so our clients can benefit for both of our work together? And we're not wasting time and energy to get sidetracked, right?
Hmm.
Ah,
Definitely.
yeah. And it definitely benefit the clients as also we are working on this out of our own time, that unbilled hours. And like attorneys, we don't build those collaborative times when we talk to each other, half an hour out of our week, right? We work voluntarily for the benefit of our clients. And not every therapist like to spend the time to do the collaborative work. Some people have a more busier schedule that they don't want to prioritize collaboration, which is personal choice, right?
Mhm.
So for me as a couple therapist, all the times we have collaborated on our clients, I really see the progress our clients just take off. I
Mhm.
remember there's one couple, I think that's our first collaboration,
Mhm.
and I've been working with them for quite a while, and we were stuck somewhere. I really felt the partner has a piece of work need to be done before we can move on in our couples work. So I reached out to Laura, and she was very grateful, and we had a collaborative chat. And since then, I can just see the client's capacity start to grow, and we're really aligned on our couples goal together. And within weeks or less than a couple months, they graduate from couple therapy.
Yes, I remember that. Yeah, it
Yeah,
was very quick progress after we connected.
right.
And, for the individual side work that that client was doing, it was also, after we connected, it kind of moved along much more
Mhm.
quickly. And very quickly, we were in this integration phase, and the client was getting ready to also graduate from individual therapy. And it was wonderful. They felt more connected in their relationship, and also that um, they had explored and made progress on the goals that they had as an individual.
Wonderful. Yes. Well, I really appreciate you and other individual therapists that collaborate with me. Because for a couple therapists, we have a certain role. When I do intake with the couples, I do meet with each of them at the beginning for individual sessions. But that's like a 15 minutes. I got to pack in the family of origin history, romantic history, and their current relationship history, and some assessment tools we go over. And it's very stressful trying to extract everything I needed to be prepared for the couple's joint sessions. So
Mm.
when Laura and other individual therapists already work with the clients for extended period of time and have thorough intakes, I get data that I don't get because you have relationship with this client
Mhm.
already and something they already share with you at different times. Oh, can be very crucial for me to know to understand the dynamic in a couple's relationship.
Yes, absolutely. In individual work, there so much of it is on a client's attachment history and experiences, and how their attachment style has formed over time, how that shows up directly in their current romantic relationship. So all of that history is oftentimes a area of focus in individual therapy. So yes, I can kind of have a much deeper sense of what is there, and offer information that's most relevant for couples work.
Yeah. And how do you feel like it's benefiting your work with the clients, like
Yeah,
prep work?
definitely.
Yeah.
I think when we connect, oftentimes I get information that I don't see directly. I
Mhm.
get information about the client and their interactions with their partner, from from you as a couples therapist. You're observing. You're able to provide
Mhm.
information that I don't directly see. And
Yeah.
then also, individual work, it's going deep in exploration. But oftentimes, if the client is also in couples therapy, the things that they need to work on are getting activated more quickly because in the relationship, it's just more dynamic, right? When we think about, um, the interactions we have with our partners, the potential triggers that come up, those are things that very quickly activate what the individual person needs to work on. And so if they're bringing into individual therapy what's getting triggered and activated in couples work, that allows us to really quickly identify, okay, this is the area we need to go deeper on. And so, it's often faster than, the exploration we're doing just in individual therapy. And then I
Mm,
think that then the progress in individual therapy then goes back and feeds into the couples work, hopefully making
yes.
it more smooth and faster as well.
Definitely. So I hear that sometimes when you work with clients individually, right, it's kind of go with the flow, whatever emerges. And I do a good job trigger my clients in couple therapy that they can bring materials to chew on in
Mhm.
individual therapy. So sometimes you go to places that doesn't surface when the client just individually, right, not in relationship. That's right. I remember the celebrity couple therapist Estelle Perel used to say, don't wait until you do all your personal work to be in a relationship. Be
Mhm.
in relationship and work on yourself in relationship because you're going to get triggered everywhere and all the things you're trying to hide will show up, right? For some individuals can be so successful in their individualization separation process. They have a successful career, they have a good job, and they have a home and they have a social life. It sounds like they're doing great, but sometimes when they're in a relationship they start to realize they're not differentiated enough. They really struggle for staying who I am while
Mhm.
being in relationships. So it surfaces something that you can't see when you're just single.
Yes, yeah. I mean, all of us have our blind spots. All of us have things that we're working on, patterns that are subconscious that we're not necessarily recognizing. So, what
Mhm.
you're talking about, being able to look at that in relationship and discover things that, that are subconscious or blind spots for us, and then bringing that into focus, more deeply into individual therapy, that I think benefits both the individual and the couple.
Absolutely, absolutely. And Laura, sometimes the clients may think, well, is that too expensive for our family if, each of us in individual therapy and we're in couple therapy? That's easily like a couple $100 per month, right? Or even more. So what are your thoughts on that?
Yeah, I recognize that. I recognize it's a investment. It's a significant investment. It means that the couple and the individual as part of the couple, they're more working in a more intensive way.
Yes.
At the same time, you're working in a more intensive way and making progress more quickly in a shorter amount of time. If we're able to do this work in a collaborative way, the client is getting kind of deeper benefits that are
Mm-hmm.
longer lasting as well. So if
Mm-hmm.
you think about it,
Mm-hmm.
you're working more intensively in a shorter period of time, but that progress is ultimately deeper and longer lasting than
Yes.
kind of this more gradual approach. Oh, I'm only doing couples or I'm only doing individual therapy. So in the long term, it's very much worth it. And there's the financial side of it, but also if you're doing this shorter term and more intensive work, and you're getting more time where you're feeling connected with your partner and you're feeling
Mm.
moving forward in your life the way that you want to, that's priceless, right? There's no price
Yes,
tag
it's
that can
precious.
give us that kind of time
Precious.
and connection.
Yes, absolutely. So I hear you saying, there's a financially in a short period of time, it's a chunk of money investing in your relationship and your personal growth, right? But the benefit of it, how precious it is, it's priceless to have that deep connection. Maybe some people never had before growing up, right? In
Yes.
this way. It's different from being connected with friends. Romantic long-term committed relationship really give you, well, activate you in a way to show your earlier attachment wounds that can be
Mhm.
healed in this way, right? So it's priceless. You can't pay for it, right?
Yeah.
You can't buy what you have to do the hard work too. All of you, right? Everybody, including the therapist, got to work really hard with the clients together. Yes.
Mhm.
I also want to add is that it may look like it's a lot of investment in a shorter period of time. If you think about, especially for married folks, we all know how expensive divorce are. I work with divorced
Mm,
couples as well as the mediator. How much attorney charges nowadays in the Bay Area? A good attorney is $500 to $1,000 per hour. And
mm.
the average divorce cost in the Bay Area is about 20 to 50K if you get contested. So if you think about that, a couple $100,000 invest in your relationship, you have a fulfilling marriage and relationship, avoiding going to court, avoiding spending all this money on attorneys, right, to
Mm.
fight each other. Isn't that cheaper, right?
Yes, it's very much worth
It's
it,
a lot cheaper than
financially and
legal fees.
also just emotional time and
Stress. Yes, the stress of going through that, right? And of not knowing the process as well. Yeah. And also the children are benefiting. A lot of couples come to me, they have
effort.
children at home. When the relationship is not attended to, either they are being cold to each other and or they're fighting all the time. The children are like sponges, they absorb everything. So they actually learn unconsciously from those behaviors, right? And so they don't really have a good foundation for their future relationships. So I'm thinking about that not as investment for the couple, but also for the next generation.
Absolutely. Yeah.
Yeah, yeah.
Yeah.
So, um, I also like to collaborate with you, Laura, because you are what I call the pro relationship individual therapist.
Mm,
I have worked with a lot of clients who have therapists sometimes are not enthusiastic about their client's current relationship because they heard
mm,
from the client, one-sided story about the other person, the partner, and they may develop, some judgments and biases, which is very human. We all do, right?
yeah.
It's very hard to hold as an individual therapist that perspective that the clients what they're sharing is from their own narrative, right? Without seeing the other person's behaviors and motives and values. So sometimes we get drawn into siding with our individual clients and may unconsciously give out a signal that this relationship sounds too difficult or does it worth to work on it, right? And then the client has a part that's flying, like fleeing from the
Mhm.
relationship, right? Which is actually work in individual therapy.
Yeah.
How long should you stay? The discerning process is very valuable. Instead of putting all the blame on the other person, just run whenever relationship is hard, right?
Mm.
So I love working with you as a pro relationship individual therapist. So it doesn't matter if the relationship or marriage works and eventually, it's a learning opportunity for the client to do some growth, right?
Yes, absolutely. I think as an individual therapist, always striving to be there to hold space for all the feelings and parts of the
Um,
client, not just the part that is feeling a certain way or getting triggered and activated by their current relationship. Because ultimately, individual work is about, coming to a conscious decision with
mhm,
clarity,
mhm,
considering all the different ways that we feel, all the different parts and voices inside of us. And so, if I, as an individual therapist, side with one, particular feeling or one part of the client, that I'm
mhm.
doing a disservice to them as an individual and to the relationship and the couple's work that you're doing. Right? So in
Right.
this way, I think the way that we work together, it fits very well and
Yeah.
also ultimately benefits the couple and individuals.
Absolutely. That's what I admire. I love working with you is you have that neutrality that you hold space for all parts. We all have different parts or aspect of us. Sometimes clients will unconsciously induce us to join one part of their aspect, right? Their psyche. That if the therapists are not aware, not holding the space for everything and got drawn into it, that can be contraindicative to our therapeutic work, right? For the
Yeah.
growth. Yes.
Yeah, yeah. It's always a learning process. So,
Yes.
you and I are, as therapists, I think are also always reflecting on this way that we
Yes.
work and how we can hold all the parts of the client. And so actually that is another benefit where when we collaborate, right? We can help each other hold
Yes,
space in that way and
that's
check the
right.
ways in which we might become drawn or biased, come
Yes,
back to
yes.
our
We
neutral
keep each other
place.
in check.
Yes, exactly. So I love working with you for that reason as well.
Yes, thank you, thank you. Well, thank you for this conversation today. It's very fruitful, and I hope our clients or future clients, whoever's viewing this, benefit from viewing this and to know, oh, what's the secret? What the therapists are talking about behind of.
Yeah, thank you for this conversation. It's really good to, just give language and kind of explain a little bit what the benefits are and how we work together. And yes, I hope clients are getting benefits out of just seeing how this might work for them.
Great. So again, Laura Bai is mostly working with individuals, and she speaks Mandarin Chinese.
Mhm.
And she also work with mixed race couple, mixed race, not mixed race. She works mostly with Asian, right? A lot of Asian
Mhm.
clients and specialize in trauma, EMDR, IFS, so working with parts. So she's my to-go person to refer to clients when I have any Asian background clients, individual clients in my couple system, or someone has some chronic trauma, CPTSD. So if you're interested, you can contact her. I will leave her contact information underneath the video in the description box.
Oh, thank you, Yi. And you are my go-to couples therapist that I referred my individual clients who are also having a lot of conflict coming up in their relationship. So I'm so grateful for our partnership. Thank you.
Yes. All right. I will see you soon, Laura.